Welcome back. You're watching The Full View here on SABC News Channel. We continue our conversation with the Gauteng MEC for Health and Wellness, Nomantu Nkomo-Ralehoko, as we'll speak to emergency services about what else they're on the lookout for this Easter period. The Department of Health, though, saying that there is a high chance of a greater outbreak of cholera because of the 4 cases that already exist. MEC, a very good evening to you. Thank you so much for speaking to us. And I'm just wondering, your concern over the baptism ceremonies that take place during this religious period, is it because you can trace the 4 cases that have been confirmed directly to rivers and dams that have been used?
Yes, it's because of that, because if you remember last, we had about 4 cases now that were coming from the people that said they were baptized from Cascade and Klip River. So immediately after that, we had to indicate to the people that now they must be careful if they do the ritual. Hence, we had a session with the faith-based organizations in the province indicating that if they are doing that, they must know that there are these cases that have just cropped up now in the province based on those people that were infected directly because they were doing that ritual. But again, we're telling people that they must know that the cholera is one of the diseases that is caused by bacteria, and usually that bacteria, you find it in water, and that water that is it's either drinking water or any other water in an area where water is not moving, if it's a river, and then you will find it there. So those are the things that we're trying to conscientize our citizens that they must be aware that in the province already now we have 11 cases that have been confirmed, and it's quite serious because some of those have to go to hospital for treatment.
Is there a particular cholera strain that has come out or been directly linked to these rivers and dams that you say are responsible for the cases that are already existing? And how many in total? Because I'm just also wondering about the incubation period. If during this period, perhaps the virus does exist, but people are unaware.
It's 4 people that confirmed to us during the interviews, because once you discover that, we do some interviews. So 4 cases that those people said they were involved in baptism activities at the local rivers. Hence, we felt that those rivers definitely should be checked. So they've taken the water to the laboratory so that they can do further checks if it's indeed they managed to get that the cholera through those rivers. So we're still having those checks. But we want people to be careful now, because once people said it's because I was baptized, I think that's why I have cholera. Hence, we have to take it up now to the team so that they can do some tests to the water. So we will definitely confirm after those tests if indeed it was those 2 rivers that they said they were baptized from them.
Right. This is why I wanted to clarify, because I believe according to lab tests, the information we have, that the samples actually tested negative for cholera. So let's look at what you've put in place as the health department, given it's the holiday period, particularly in formal settlements. I know the source of contaminated water and food could then be high in terms of the spread. What are you doing? Are you employing additional workers, water tankers, to ensure that people are not vulnerable?
For us, I think what we have done is to activate our command center so that we are able now to inform people about this, and we are trying all measures to put up in place. And we are going around the province educating the citizens about the importance of making sure that they take care of themselves. They must make sure that they don't drink water that is not boiled, and because if you drink water that is contaminated or polluted, you definitely have cholera. So because the samples came out negative, but it doesn't mean that they didn't get it. They get it somewhere. So which means we need them to check exactly where did they get it in their respective places. But again, we have a program that we have just activated again of going to the to
All
the
right.
communities, especially in the informal settlements and in the hostels, making sure that in every area, if they buy food, people that are selling food, they must clean their places so that they don't infect our people.
Point taken. Thank you so much for your time. Nomantu Nkomo-Ralehoko is the Gauteng MEC for Health and Wellness.